Varicocele, if you notice visible veins around the testicle or feel any pain in the testicle, or if you start to notice a change in the size of the testicle, atrophy, meaning the testicle is starting to shrink, especially at a young age, go see a urologist, let him examine you and do an ultrasound. Now, if you've been married for more than a year and have been having regular unprotected intercourse, and there is a delay in having children, you must go to a urologist so he can examine you and make sure whether you have varicocele or not. Peace be upon you. Varicocele is a very, very important issue that concerns many of us. And honestly, we see it a lot in the clinic, and I get asked about it very frequently. When should I know that I have varicocele? So, doctor, when would I need surgery? Does having varicocele always mean I have to have surgery? Does varicocele affect fertility? Can varicocele cause pain? Can there be complications from it? Honestly, these are a lot of questions I get asked in the clinic, so I wanted to make a video to clarify this topic of varicocele. And before we talk about the symptoms, and before we discuss the treatment, we first need to understand what varicocele actually is. A varicocele is, like any other varix, simply a group of veins. These veins carry blood from the testicle and return it back to the circulatory system. But when the pressure inside them increases, the wall of the vein starts to stretch, just like the varicose veins you see in the legs. These are basically veins whose walls have become weak, so they begin to expand and fill up with blood. So, what's the problem if this happens? Around the testicle. In fact, they found that, according to one theory, when varicoceles occur, these veins carry more blood than normal, which increases the point temperature around the testicle, and this affects the quality of the semen. They found that varicoceles affect fertility because they impact the quality of the semen. So what are the symptoms? In reality, varicoceles don't have symptoms unless they reach a very advanced stage and inflammation starts to occur. Then they cause pain in the testicle, and veins begin to appear visibly around the testicle. So when should I see a doctor? If you notice visible veins around the testicle, feel any pain in the testicle, or start to see a change in the size of the testicle, meaning atrophy, especially if the testicle starts to shrink, particularly at a young age, go to a urologist, let them examine you, and have them do an ultrasound for you. Now, if you've been married for more than a year, having regular unprotected intercourse, and there's a delay in having children, you must see a urologist so they can examine you and determine whether you have varicocele or not. So what do we do for the patient? The first thing we start with is the examination. We begin by examining the patient to determine the grade of the varicocele, check the size of the testicles, and take a thorough history from the patient to see if he has fathered children before or not. After that, we do a Doppler ultrasound on both testicles. The Doppler turquoise measures the blood flow, the amount of blood entering these veins, and whether there is any reflux or not. We have 4 grades of varicocele. The first one is called subclinical varicocele. This is subclinical, meaning we can't see it or feel it during the examination. It can only be detected by imaging. And in fact, this type doesn't require any treatment. The second type is first-degree varicocele, which appears when you increase the pressure inside the abdomen. When the patient coughs or strains, the varicocele becomes apparent. That is, I can feel it without the patient having to increase the abdominal pressure. The third degree is when I can see it with my own eyes without needing to examine it. So when should we intervene or perform surgery? If there is a varicocele in the testicle, first in young age. By young age, I mean puberty and the period just before puberty. If we find that the varicocele has started to affect the size of the testicle or it has begun to atrophy, then we must perform surgery in order to preserve the remaining part of the testicle. Second, when the varicocele is one of the causes of delayed fertility, and in fact, varicocele accounts for about 80% of the causes of delayed fertility and affects the quality of the semen. The third point is, if the varicocele starts to cause complications, what are the possible complications that can occur? In fact, third-degree varicocele, which is the largest and most severe form, can cause inflammation of the vein wall. That means inflammation occurs in the wall of the vein, and sometimes this happens repeatedly, becoming bothersome and painful, causing discomfort. In such cases, we remove the varicocele. So, can varicose veins cause pain even without inflammation of the vein wall? Yes, especially in people who stand for long periods. You see it a lot in teachers. You also see it in people whose jobs require them to stand for long amounts of time or for extended periods. This increases the blood pressure inside these veins and causes very severe pain. In that case, we would also need to perform the surgery, So, to recap, the first thing is young age, and if testicular atrophy has started, or if it's affecting fertility, or if there are recurrent inflammations, or if it's causing pain. Are there different types of surgeries? Or is it just one procedure? There are actually many different types of testicular removal surgeries. They can be done using laparoscopy or through open surgery, and they can also be done using interventional radiology, where we inject a substance into these veins to close them off. Even with surgery, there are several types, though I won't go into too much detail. The surgical results are the best, especially with a specific type of surgery called subinguinal microscopic or inguinal microscopic surgery, where we open up the spermatic cord in the area of the inguinal canal, and we use magnification tools so we can see the veins clearly and close them all off or tie and cut them. And honestly, this is what gives the best results. So does varicocele surgery yield good results when it comes to delayed conception? The answer is yes. It does help with delayed conception. As we agreed, 80% of its causes are due to varicocele. And honestly, the procedure is simple and at the same time gives very good results. We do a semen analysis 3 months after the operation. Why 3 months? Because sperm needs 72 days to form, so we need to wait in order to see the new sperm that was produced after the surgery. We need to wait 3 months so we can repeat the analysis again. This is related to the surgery, and as we agreed, if we can't detect it through examination, then we don't perform any surgical interventions. So, are there any complications? We agreed on the possible complications. We mentioned testicular atrophy, delayed fertility, and that inflammation of the veins can occur. These are the complications that can result from testicular medication. Now, there are some questions. People have asked me also related to testicular medication. Does testicular medication affect erection? In fact, it has absolutely nothing to do with it. Testicular medication has no relation to erection. Testicular medication affects fertility. Yes, testicular medication affects the quality of semen and therefore it impacts fertility. So which procedure is better? There isn't one that's better than the other. Some people say that endoscopy is better than surgery, but in reality, when it comes to results, we found that surgery gives the same outcome. The results are the same as with endoscopy. There's not much difference, and the incision is almost the same size, maybe even smaller, because with endoscopy, we need to make 3 openings. One for the camera, one for the right handle, and one for the left handle. But in surgery, we make a small incision just 1 centimeter above the neck of the testicle, right above the neck of the scrotal cord, so we can bring out the spermatic cord. So it's just 1 incision, only 1 centimeter. All the procedures are good, and there's no problem with any of them. But as we agreed, the inguinal microscopic technique gives the best results. Another question I was also asked is, should we perform varicocele surgery at a young age if it's not affecting the testicle? No. The varicocele must have started to affect the size of the testicle before we can perform varicocele surgery at a young age. In the end, I hope you found the video helpful, and if you liked it, please give it a like, share it, and subscribe to our channel so you can watch the rest of our videos. Wishing you good health. Peace be upon you.